to that, I mean, a lot of Americans are kind of forced into self-treatment because they can't afford health insurance or they can't afford medication or something. Are there a lot of
Yeah.
doctors that take this, or even doctors, psychologists that take this into consideration? Like somebody might be helped by cannabis or kratom, even where it's illegal. Are there a lot of doctors that take that into consideration, or do most have to kind of follow the FDA guidelines and whatnot?
There are more and more.
Yeah.
That's a really good point. One of the You mentioned that people can self-treat with this,
Yeah.
and sometimes doctors look at that as a negative thing, and it depends. But uh, there are a lot of people who are benefiting from this who would never go into a hospital or a doctor's office and get a prescription for something. And right, because of healthcare costs or whatever reasons, the
Mm.
medical system is not for everybody. We'd like to think it is. We'd like to make it for everybody, but it's not at this point. And so those people who won't do that or can't do that, it's important that they have access to reasonably safe plants like kratom. As far as the doctors that understand its potential, I think it's growing. I
Mm.
think it's a matter of education because we have a system that splits things into good drugs and bad drugs.
Mm.
And it's much more complicated than that. And because kratom does have some potential for tolerance and withdrawal, doctors are wary of it at the outset. But as more papers are published and more doctors are educated on the potential benefits of kratom and what the risks are, and that they're not the serious adverse events. I mean, it's really a low number.
Mm.
Uh, I think that it's moving in the right direction at this point, and that there are some doctors who will listen to patients and their experiences that value that first and most of all. They're out there.